now be recorded.
Okay. Floor is yours, Pam.
Oh, okay. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, GL 30A 20, and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Harwich Board of Health is being conducted via remote participants. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. And I now call the meeting to order. I'll do a roll call. Matt?
Here.
Sharon?
Yes.
Don?
Yes.
Okay, so everybody's present. Let's review the minutes from the previous meeting. Do I hear a motion to accept?
I make a motion.
Motion to accept. Go ahead. I'll second it.
Okay, Sharon, and then Don, and anybody in agreement with this?
Yep.
Okay, so motion to accept has passed.
Okay. Let's see. So we can now start. Yeah. Yeah.
1 second, Meg. All the votes have to be by roll call. Just a reminder.
So Pam, you'd go through every member, even after one person makes a motion and another seconds it, you'll have to say all those in favor, and you'll say Matt, and he'll vote. Sharon, she'll vote, and then Don, he'll vote, and then you'll do your.
It's not Don, it's Ron.
Ron,
I'm sorry. Oh,
you'll go through
long day.
each person and do it that way.
Okay, we'll do.
All right. So for the minutes, you'll have to do a roll call vote.
Okay, Ron?
Yes.
Sharon?
Okay.
Okay.
Thank you. The next thing on your agenda is your work session. Item A is a continued review of draft Town of Harwich nutrient and pesticide control bylaw / education. This has been continued from the April 21st Board of Health meeting. I did not prepare anything for obvious reasons. So you can discuss this amongst yourselves and decide what to do with it.
I think we should talk about it later on. I think we have other things now.
I would make a motion to postpone this to a later meeting. We have to give a date.
You can say a future meeting, like you can say the September meeting or something like that to a date certain, but it doesn't have to be next month.
Well, that might be a good idea, September.
Yes.
September sounds good to me, yes.
Okay, I make a motion that we postpone this discussion till September.
Okay, Sharon's making a motion, and second?
I'll second it. Okay, go ahead. Doesn't matter.
Matt will second it. All in favor?
Aye.
Ron?
Yes.
Okay, Sharon?
Yes.
Matt?
Yep.
Okay, and myself agree to postpone it until September meeting.
All right. All right, moving on. The next work session is a COVID-19 update. I will provide some information on what's been happening over the last month, but more specifically over the last couple of days. Big things have happened in the last couple of days. And I'll open it up for questions and comments and other information that you may want to know about. First, the numbers, today's case number for the entire state is 87,995, and we are now at 5,938 deaths in the Commonwealth. And Harwich, we have remained at 107 for almost a week now. 107, 67 of those cases are related to Wingate. Some are residents, some are staff within that number, leaving 40 cases outside of Wingate. At least 31 of those cases have 4 have died. 13 deaths.
It's 4 from Wingate have died.
13 from Wingate have died, and
13.
four from the community. So our death rate in Harwich right now is 17.
17. Okay.
Megan, do we know how many people were actually tested in Harwich? In other words, like, are we only testing people that either were admitted to the hospital or had symptoms, or are we doing any kind of like community testing that would give us a prevalence of what might be in the town? You know, basically positive people that are unsymptomatic.
Mm-hmm. Just up until yesterday, the only people that were eligible for, not yesterday, last Thursday, the only people that were eligible for a test were those with symptoms or those who were exposed from a healthcare worker standpoint. So if a police officer or someone in the hospital was exposed to someone who was a known positive case, that person could also get tested. Last week, they announced that close contacts of positives are now eligible for testing. All nursing homes and assisted living facilities are eligible for testing of patients and staff residents, even if there aren't any symptoms. But outside of those long-term care facilities, there is not widespread testing of asymptomatic people yet. The governor's orders have tried to expand our testing capacity to 45,000 tests a day. Right now, we're in the 15,000 range on a daily basis. So he's trying to ramp that up, and part of that is to allow for widespread testing. Certain facilities can partner with healthcare facilities to do testing of larger communities. Like, for instance, Martha's Vineyard, it has partnered with Partners, the health group, to do testing of all residents. It's something that I'm looking into doing, possibly partnering with either Outer Cape Health or Fallon Medical or something like that to do at least town employees who want to get tested. But right now there is not a mechanism for just anyone off the street to get a COVID test unless they pay for it out of pocket.
Okay.
Or get a doctor's order, right?
They'd have to get a doctor's order. Doctors they need to have a reason. They can't just have anybody tested for any reason. They have to meet the guidelines for it.
Okay.
What kind of test is that? What kind of test is they given in the nursing homes right now?
They're doing the nasal swab, the PCR test.
Okay. So how long does that take to get a result?
There's a rapid test that can take about a half an hour, but that's not the test that's being used at facilities, and it is taking 24 to 48 hours to get results.
So the rapid test is the Abbott, the one that's giving us.
The rapid test at the hospital, it takes 4 hours.
Yeah, and that's the one where we're getting the false negatives. The Abbott.
Oh, I don't know.
Yeah, I think that's the rapid Abbott test. I think it's the one.
Anybody who's symptomatic at the hospital that came in negative, they do it again 24 hours later.
Okay.
And it's not a pleasant test.
I know, I've been told it's quite a long swab.
That's a nasopharyngeal test. They aren't pleasant.
Right. So that's where we're at with cases, and Wingate did have the National Guard on site helping with staffing, and I believe they still are there because 12 of their staff members tested positive and caused them to be out of work for 7 to 14 days, depending on their symptoms. So they were quite shorthanded for a while, and the National Guard stepped in to help with staffing. The Department of Public Health holds a daily call with the Wingate staff, the director of nursing there, to make sure that they have all of the PPE they need and all the assistance that they need. So far, Wingate reports that they have everything that they need.
What's the average age of the staff at Wingate? Do you know?
I don't know the average age of the staff. I know the average age of the people that are testing positive is 82.
Yes, I know, but that's what I was wondering about the staff, though.
I don't know. I don't have much.
I hope the staff is an 82.
Yeah. Right. I don't see the staff demographics, mostly because they're don't live in town, but I don't have that information. But I was told that all 12 of the staff members that did test positive were asymptomatic. So they were.
Okay, they were also asymptomatic. Okay.
Right. So that's most likely the cause of the transmission between rooms, because the staff didn't know they were positive.
Well, close contact also. Yeah, very close contact, yes.
Yes, yeah. Other parts of your packet have in it all of the guidance documents that have come through between myself and interim Town Administrator Joe Powers. We have made some changes to office spaces, and we've been retrofitting town buildings to have plexiglass. We're going to be putting arrows on floors to show social distancing and traffic flow of people, so we can meet some of the mandatory safety standards that the governor's office has put out for all office buildings. We have done a few reverse 911 calls since we last spoke about open to the public. So a grocery store or a different type of store, they must wear a face covering. And when you're outside and you're not able to social distance, you also have to wear a face covering. And that's anywhere in Massachusetts. Other parts of my monthly reports, I'm trying to get to it in the agenda. We have daily check-in calls with department heads that we go over day-to-day information, because everything seems to change on a daily basis with the state. There is a reopening task force on the Cape locally, as well as a state-appointed reopening advisory board. And I'd like to move into that advisory board and some of the guidance that has come out. I'm going to try to share something on my screen. Let's see if this works.
I have a question while you're trying to do that. Is there anybody from the public health that is on the task force here on the Cape?
Yes.
Okay.
So the people that are on the task force is at the end of the report. So we have Monica Barrell, who is the commissioner of the Department of Public Health. We have restaurant owners, Nantucket business owners, a couple of mayors, the president of Worcester Polytech Institute, some other industry people. We have a doctor from Mass General. Not too much Cape representative on the reopening statewide task force, but the Cape Cod reopening task force has Senator Julian Sear and Sarah Peak on it, and they are in contact with towns. They were actually just on the selectmen's meeting last night.
Yes,
and they are in kind of daily contact with Cape industry. So we are represented, if not by name on the members group, but we have definitely an ear of all of those members.
Okay.
So just yesterday, the governor's office put out this reopening, and I am gonna share my screen. There we go. Wow, all right. Okay. And part of this 29-page reopening plan goes over a little bit of the history and all of the stakeholders that were involved. So this page shows all of the stakeholders that were part of this reopening task force. And then we'll keep coming down. It's a 4-phase approach, and it's driven by public health data. In order to get from one phase to the next, they're going to be looking at these 4 metrics in order to see positive trends. So they want to see positive trends in number of positive cases each day, the average hospitalization rate, average ICU surge capacity, and the average day of deaths every 3 days. They want to see trends going down in order to see us going from one phase to the next. So right now we're in phase 1, which is the start phase. So we want to see certain things across all industry, social guidance, which is the hand hygiene, washing your hands, covering your face, and businesses need mandatory workplace standards, and there's sector-specific protocols that are very specific. They're easy to read on the website for construction, for churches, for barber shops, and every section of industry they're going to have a guidance document for.
I did read those. I thought they were done very well.
I thought so too. Yeah, I thought so too. So things that all businesses are going to need to do in order to open are to self-certify according to the Mass COVID-19 checklist for their specific sector. And they need to post a self-certification. And it's something that the Division of Labor Standards will be checking in on as an agency, but it all does kind of fall on the Board of Health's shoulders. So here's a little thing of the phases. So phase 1 we're in now, and we're opening up limited. So right now we're mostly with essential businesses. Next week, retail can open for curbside pickup, barbershops, hairdressers, pet groomers, and car washes can open up next. And they say that each phase will last a minimum of 3 weeks, and they could go longer if those metrics aren't showing positive trends. Phase 3 and 4 is the vigilant 4, where we're going to open up even more businesses, and then phase 4 is the last one, which is going to be called the new normal. And this page is a little information on what will open and when and other guidance. So we're still in phase 1 and we're still saying we're safer at home. It's not a stay at home advisory any longer. It's a safer at home. Promote staying home, especially high risk individuals. No gatherings of more than 10 people. All travelers are urged to self-quarantine for 14 days, and lodging is restricted to essential workers only. So that means Airbnbs or hotels, motels for vacation rentals. They can only rent to essential workers. Like I said, worship is able to reopen again. One of the guidances there is that they have to stay at 40% capacity. Other businesses, we were really hoping restaurants would have different guidance this phase, but unfortunately they are kind of in a stay as you are pattern right now with curbside pickup only or delivery. You can go in and order, but you can't sit down. They are part of phase 2. So we've gotten quite a few restaurant owners calling with questions on when is phase 2 starting, what's it gonna look like, and earliest it will start is June 8th, but like I said, that's kind of a moving date depending on data. And we've talked to the different departments in community development, and we're eager to work with restaurants for outdoor dining. We know it's going to be a hard, tough, small time frame summer, so we don't want to put up any additional roadblocks to them.
Megan, I have a question. On that. Can restaurants can they have outside? Do they have to have a permit to have outside dining beforehand? In other words, there are some restaurants that have outside and inside. Are there 2 types of license?
Yes and no. It's kind of a complicated question, but some restaurants that already have outdoor dining are able to, I shouldn't say are because it's not allowed yet, but once they are able to have dining, they can utilize their outdoor dining as they've been previously approved. But some restaurants that are looking to expand their outdoor dining or start a new outdoor dining will have other requirements. In a non-COVID world, they'd need to go through site plan review through the planning board and make sure they don't have any zoning bylaw problems. We are looking to give relief for those types of issues. I can't give you any specifics because they haven't been figured out, but we are looking to give relief for a temporary situation this summer. So if you don't already have outdoor dining, there will be some hoops you'll have to jump through in order to get it, but they won't be as extensive as they would be if we were under normal circumstances.
By expense, you mean, what do you mean by expense?
Extent.
Extent, okay.
Right.
Yeah.
If the restaurant opens up to dining at all, they'll need to provide a restroom.
Okay.
So just like offices or town hall or the beaches, well, they'll have to have a daily cleaning and disinfection schedule. Yeah.
Okay.
Megan, I just have a thought there. When we were over in Europe, over in Nice, they had a lot of the restaurants, during the day they were eating out on the sidewalks. And then at night, they shut the streets down. They kept the side streets open so that you could drive into that. But each block was blocked off. They had lights out and so they had dining tables with little lights that were run battery operated, sitting out on the tables. Is that something that the town could think about? I mean,
Yeah, we have thought about that. We've had some restaurant owners kind of pitch that idea to us, and it's on the radar. Nothing's a solid no at this point. It's just a matter of
do it.
can we do it right. Like for instance, Route 28 is a state-owned road and not a town-owned road. So what kind of issues does that raise? So hopefully it is a smooth transition, but you know, there's lots of things to think about. Yeah.
But I knew that that was kind of nice. They string lights across and you're sitting out there. It was really nice. It really was.
Yeah.
If there's some way to do it, that would really, I think, work nice.
I hope so too. Other things that are happening in phase 1, the state has provided guidance on outdoor recreation, and that's beaches, parks, drive-in theaters. Tennis can start up again, fishing, boating, those sorts of things. The beach guidance is pretty. It's based mostly on social distancing. So beach parties have to stay 12 feet apart from each other. So there's, you know, an aisle that you can walk down that so you won't be within 6 feet of other people.
Are they opening up in Harwich Center?
I don't know. We are able to legally, I should say, but it's a matter of, do we have the staff to do that right now? I know it's on the list of things to do. So as soon as we get the staff and are able to direct them to open those up again, we will get on that.
Okay. Is there a date on that or how's that?
No. I mean,
Okay.
these guidances just came out yesterday, so I don't know.
Okay. All right.
Okay. So this part is just more in detail of what those phases are. As some of you know, some of the childcare, most daycares have closed because of COVID, and they're expanding some of those daycare options. And transit options are also going to be modified to have staggered schedules and whatnot.
Megan,
Yes.
I was reading over the one on the beaches.
Yeah.
And they were talking about parking lots, and then they went into under other sand vehicles.
Oh, over sand vehicles. Yep.
Over sand, okay, over.
Yep. Over. So we don't have any of those in
We
Harwich.
don't have any of those. So then when it comes to the parking, are they thinking of doing anything for parking in order to limit people on the beach, or are they thinking of anything?
So we talked about that. In Harwich, we have small parking lots in comparison to the beach sizes.
Yeah.
So even at full parking lot status, we could still have an empty-ish beach, apparently. This is according to the beach director. So we had considered closing off or having a limited capacity beach parking lots, but he has said that even at full capacity, say Bank Street Beach, which usually does fill up in the summer, the beach parking lot, the beach itself is expansive, so people can still be 6 feet away from each other. So we're not going to put a limit on parking.
Then the other question that I've had some people ask me about was, what about the bathrooms?
Bathrooms have a specific guideline, and they're going to have signs that tell people they have to social distance and wash their hands and sanitize, but they will be open and they'll be cleaned once or twice a day and deep cleaned once a week. That's what the guidance suggests.
Okay.
I would really like to see a a restroom attendant, but I don't think that's a wish. that's a dream in order to keep the bathrooms clean. But people need to take on some responsibility for themselves.
Yes.
So we can't be moms to everyone and wash their hands for them.
Hopefully they bring their own hand sanitizer.
Right. In your packet, one last thing is short-term rentals. We had gotten an email in your packet from a Luke Chapman. He is a Board of Health member for the town of Orleans, and he's also a business owner in the short-term rental realm of things. And he has come up with some short-term rental guidance for cleaning in between renters. And I think we may want to take this back up in June or just take it under advisement. The guidance, I believe, that the state will come out with is going to be quite similar to it. And I wanted to he wanted it to be on your agenda to discuss it. And I wanted you to see it as something that you can adopt yourselves eventually, or you can leave it up to the guidance of the state in the Cape Cod Reopening Task Force. So if you want to go to that in your packet and let me know.
I did look at that. I guess my thought would be, it might be wise to wait until the state comes out with something rather than move ahead with this right now. I would think that if the state would have to be coming out with that soon if they're going to do anything. I don't know if you've heard that they're working on something or.
Yes, they're working on guidance for every section of industry. So short-term rentals, hotels, lodging, that is an industry that they have someone working on. So I agree. I think doing any sort of guidance or regulation or restriction on our own would just be, I don't want to say a waste of time, but an effort that is just going to be overridden by the state.
That you might end up having to modify anyway later on. So, give the state time to do something. And I guess if the way it usually works, if you want to make it stricter, if for some reason, you'd want to, that you can make it more strict than what the state, just not less. So I guess to me, it makes sense to maybe hold off on this. I thought it was very good, but I think just hold it off until the state comes out with it and then look at what the state has and what this suggestion was. And if we wanted to adopt something that the state hasn't done, this one recommended and we like it, then go from there. I guess that would be my suggestion.
Mm-hmm.
Megan, when are the beaches supposed to open?
The beaches never closed. So the beaches are open. The beaches were never closed.
I mean I don't mean by open, I mean by lifeguards.
Lifeguards on any typical year aren't at the beach June 27th. So
June 27th?
Right. Stickers will be on sale at the beginning of June. If you have a sticker now, it's not, it doesn't expire till the end of June anyway, so you wouldn't need a new one.
Yeah, okay. Right.
We will have monitors on the beach of some level. I want to call it COVID enforcement, just to check on social distancing and making sure that groups aren't gathering. I
That's going to be tricky.
Yeah. Any other comments or questions on reopening or any specific industry that you guys feel you want more of a discussion on before your next meeting?
No, just a quick thought, not necessarily on that, but going back to the short-term. If for some reason the state comes out with that before our next monthly meeting, and it's something that we would feel like you want to address sooner, can you call a meeting just to discuss that?
Yes.
You know, if something like that would come up that you might want to do before the, you know, not necessarily a full Board of Health meeting, but, you know, if something comes up that we need to address sooner, just like a mini meeting.
Yep, we can do that for any reason. We can call a meeting and have it, I think it's 48 hours later, we can have a meeting. We just have to post the agenda and have it 48 hours later. So at any time, if there's something that comes up that you want to have an urgent meeting on, you'd reach out to Pam and she can reach out to us to set up a meeting.
All right. Okay. Okay, good.
All right, everybody okay if we move on to new business?
Yes.
Yep.
Okay.
Yes.
Our first hearing is Deloree Murnane at 113 Brooks Road to consider a variance request to upgrade a Title V septic system prepared by Moran Engineering Associates. And Pam, this is the one that has asked for a continuance. So if you want to open the hearing, hear the continuance request, and then move to continue it.
Okay. I open the hearing and
The applicant
motion.
is requested to continue this to the next Board of Health meeting.
So I need a motion for a continuance to the next Board of Health meeting, which is when?
June, let me see,
June 16th.
June 16th. Thanks, Jen.
To June
I'll make a
16th.
motion. I'll make a motion to continue it.
Okay, Ron's making a motion.
Ron, not Don.
Ron, I know, I said Don, then I said Ron. My husband's name's Don, I messed up, I'm sorry. Do I hear a second?
I'll second.
Matt, seconding it. Sharon, do you approve?
Agreed.
Agree, okay, and I agree, so all in favor.
Sharon, yes.
Okay, the next hearing we have is for Jaworski, 113 Bank Street, to consider a variance request to upgrade a Title V septic system prepared by Down Cape Engineering, Inc. Variances from 310 CMR 15-11, minimum setback, to allow a proposed soil absorption system to be 12.7 feet from a foundation where 20 feet is required. Variance request of 7.3 feet.
Good evening. Can everyone hear me?
I'm opening the hearing. Yeah. Welcome.
Okay, great. My name is Danny Gonzalez with Down Cape Engineering, here on behalf of Karen Jaworski and her property at 113 Bank Street in Harwich Port. We are proposing an upgrade of the existing 6-bedroom septic system. And due to the relatively small size of the lot, as well as there being a garage and pool as well on the lot, we are asking for a variance to the foundation setback. We are proposing a 40 mil liner in between the leaching field and the foundation. Pretty straightforward, but I'd be happy to answer any questions that you have.
Okay, I close the hearing. Any discussion from the board?
No, not for me.
No.
Megan, can I have your recommendations?
Sure. The existing 6-bedroom dwelling is currently served by 4 cesspools, 2 on the north side and 2 on the south side of the dwelling. The Applicant is requesting the variance due to the small size of the lot and the 6-bedroom design flow. The plan provides a 40 mil liner between the edge of the soil absorption system and the foundation. There are no construction or alterations proposed to the dwelling. It did not require approval from the Conservation Commission, and it is an improvement over the cesspool, so I recommend approval of the variance with the following conditions. The property shall be restricted to a maximum of 6 bedrooms. No increase in habitable space or square footage allowed without further review of the Board of Health, and the variance and conditions shall be recorded at the Barnstable County Registry of Deeds.
Do I hear a motion?
I make a motion that we accept the as outlined.
Okay, Sharon's making the first motion. A second?
I'll second that.
Ron is making the second motion. I'm so sorry. Are you in agreement?
Yes.
Okay, and I'm in agreement, so unanimous, it passes. Okay. That's
Thank you very much. Have a good night.
Good job.
Stay safe.
Okay, the last thing on your agenda is permits. We have food establishments, no new ones, bathing beaches, and septic installers, 1 recreational camp, and the camp we are going to hold because they are not able to operate under the current governor's orders. And no new ones. So if you have questions or comments, but I would just request that you hold the Pleasant Bay Community Boating Camp until after the governor's orders lifted.
I do have a question, and this is more procedural. So these permits, like establishments or whatever, will list like the number of seating. So if we as the town go ahead and okay these permits, if the governor, you know, if his regulations say, you know, it has to be 50% occupancy or whatever, then that would supersede anything we do, so that we wouldn't be, they couldn't come back and say, oh, well, the Board of Health, you know, approved my permit so I can have 160 seats or something like that.
No, the governor's order would supersede ours as far as the number of seats that they could have.
All right, I thought that. I just didn't know whether they, you know, could say, well, the board gave us the okay.
No, as you were bringing that up, the only situation I can think of is if they're only allowed a certain number of seats, but they've paid a permit for more seats, they could request a refund. That's just what went through my mind when you started to talk, because our permits are priced based on number of seats.
Oh, that's interesting. I didn't know that.
Yeah.
Okay.
okay. Do I hear a motion to accept the permits for all except the Pleasant Bay Boating Recreational Camp?
I make a motion that we accept all the permits except for the camp. Is that enough? As the camps go?
Okay, Sharon's making the first motion. A second?
I'll second it.
Matt's second. Ron in agreement?
Yes.
Okay, and I'm in agreement, so
Roll in agreement.
permits have passed except for that one. Okay. All right.
So unless you have anything else to discuss, someone can make a motion to adjourn.
Do I hear a motion to adjourn?
Before we adjourn, are we subject to changes with recreational, in other words, let's say Memorial Day weekend, this weekend is going to show us some things. Now, is the governor going to come out and talk about anything, or how's that work with relationship to the health department? In other words, is the governor going to give you, are we going to adopt new methods as soon as he starts talking again, or how's that?
Which is supposed to last at least 3 weeks. Over the next 3 weeks, we'll be getting guidance that will help us regulate those in phase 2. So over the next few weeks, we will get more information from the governor's office and the reopening advisory board on how to handle businesses that are beyond phase 1. So restaurants was one of those. So we'll have information on
more guidance on that before the next meeting. Yes.
Right. So if there's something that comes out of that guidance which I'll share with you, but if there's something in that guidance that you as a Board of Health feel you don't like or want to change or want something different, then you'll need to meet and discuss it. Otherwise, we'll just go forward with the governor's guidelines.
So,
good.
So are the beaches in phase 1?
Yes, the beaches are in phase 1.
Okay.
So as of the 25th, which is Monday, they need to have the safety standards in place, which is signs at the bathrooms about social distancing and someone enforcing social distancing on the beach. They can't have any group activities like beach ball, volleyball, that sort of stuff. They can't have rental equipment like kayaks and stuff. That's all in phase 1.
All right. I missed that down there under recreation and outdoors. I saw the first part and I thought, I don't see beaches there. They couldn't imagine they couldn't open those. Yes, I see it now. All right.
When are the bathrooms will be open on Pleasant Street Beach and Earl Street Beach?
I know that some of them will be open Monday if we have the janitorial staff to clean it every day. So beaches aren't required to be open as part of the beach openings. But if we do open them, they have to be cleaned every day. So right now, the town is not fully staffed in the janitorial department. So if we're unable to keep them clean, we can't open them. So I know we're trying to get most of them open for next week.
Yeah. Did the town apply for any of the PPP loans or anything like that, or are you in other words, budget-wise?
Yep. So the state gave each board grant, which we are in possession of. It's about $12,000. That's not very much, but it's going to cover our nursing contract with VNA and any PPE that we've had to purchase. So we've purchased masks and gloves and so it'll cover that. But as a municipality, we are able to get CARES Act funding, which will be over $1 million to pay for things like retrofitting town hall, additional staff for enforcement of COVID-related issues.
Well, like on the beaches and things like this, or parks, whatever it is,
Right.
Yeah,
even the golf course has had to hire additional staff to enforce the COVID rules.
So is the golf course at Cranberry open right now?
Yes, right now it's open for members only because one of the stipulations is a contactless payment. So they don't have a remote payment option for non-members. They're working on it. Hopefully by the weekend they'll figure it out. But yes, they're open. You have to make a tee time. You have to have no more than 4 people in your party, and the clubhouse is closed.
So they can't use carts?
They can't use carts unless they have a disability, and they have to show a handicap placard, or a letter from their doctor.
Yeah, how about bathrooms and things like that?
The clubhouse is mandated to remain closed. They are considering porta potties. I know that's not a very good option, but it's better than going in the woods. So, when you're out there for 18 holes, sometimes it's unpleasant. So they're looking into porta potties.
I had something else I wanted to ask about the people coming off Cape that are supposed to do a 14-day isolation. Yeah.
Yep.
What are they? And then they were talking about the 1-day passes on the beach.
Mm-hmm.
So, how do they square those two things?
So I brought this up at the selectmen's meeting.
Or isolate for 2 weeks.
Well, right. So the self-quarantine for 14 days is for travelers from out of state. A lot of people from within Massachusetts, even from other towns on the Cape, will buy a 1-day pass to go to Harwich. So to have to show residency or a lease agreement showing that you've been here for 14 days is just a little, it's too much for us to handle. So again, we can't police every person that comes across the bridge. So we're doing what we can. We're putting inserts into the rental density permits that the building department provides, and signboards, just trying to go the education route on that.
Oh, I would just wonder, because I thought that was going to be
that was my first gut instinct, was why would we sell a day pass to a non-resident? But points were made, someone from Brewster might want to go to a Harwich beach, so that's all we can do.
Yeah. Okay. Just wondered how you were going to do it. All right.
These aren't easy decisions.
No, they're not. They're not easy decisions. They're complicated. They're complicated. So. Okay. I make a motion that we close the meeting.
Do I hear a second?
I'll second it.
All in favor?
Aye.
Aye.
Okay. So
Aye.
everybody is in favor. Do I have the names again? Ron and Matt and
Yep.
Sharon, myself are in favor to close the meeting.
Okay.
All
Stay
right.
safe, everyone.
You too. We'll see you later.
Okay, Dawn.
Good night.
Bye, Dawn. Bye, Dawn.
See you next month. Okay.